Hello, my name is Kweku. I am a pharmacist. Today, I'll be briefly reviewing the medication Atenolol. We will be taking a look at a brief description of what it is and what it is used for. We would also take a look at the dosing, the side effects, and we'll also take a look at some warnings or some best practices. Brief disclaimer that this review is for informational purposes only and is not intended to be a substitute for medical advice from your physician. So what is Atenolol? Well, Atenolol is a beta blocker, and beta blockers at a very high level decrease the amount of work that your heart has to do and also helps your heart to beat more regularly. Atenolol is used to manage hypertension or high blood pressure. It is also used to manage or prevent angina, which is chest pain. Atenolol may also be used in acute myocardial infarction, which is just a heart attack. So it may be used to prevent a second heart attack from occurring in somebody who's already experienced one. So it's not unusual to see people put on beta blockers after an acute myocardial infarction. Now, these are the FDA approved uses. Atenolol may also be used in certain situations that we call off-label. That means that they've not necessarily been approved by the FDA for that, but they know that it does work in those circumstances. And that includes cardiac dysrhythmias or irregular heartbeats. Atenolol may also be used sometimes in the prophylaxis or the prevention of migraine. And it is used also in a condition called thyrotoxicosis, which is characterized by an excessive thyroid hormone in the system, which causes palpitations and increased heart rate. Atenolol may be given in those circumstances to resolve that situation. When it comes to dosing, the dose may range anywhere between 25 milligrams to 200 milligrams daily, depending on what condition is being treated. Usually, they would start you low and kind of work your way up. So for example, somebody with hypertension may potentially start on 50 milligrams, and that may be increased to 100 milligrams after about a week or so if the desired result is not achieved. It's typically given once a day, but it is also not unusual to see sometimes doses being given twice a day. Some of the more common side effects include bradyarrhythmia, which is a slowing of the heart rate. There's also been reports of hypotension where the blood pressure dips too low than expected. Dizziness has also been reported, so it's definitely a good idea to know how your body reacts to it if this is the first time you're taking it. Changes in sex drive or performance have also been noted with Atenolol, as well as anxiety and nervousness. There's also been reports of what is called cold extremities, where you have cold, tingling, or numb hands or feet. Some breathing problems, as well as fatigue, has also been reported among people taking Atenolol. Now, with respect to fatigue, that seems to be a very common occurrence, occurring in about 26% of the population. So that tells me that approximately every 1 in 4 people that takes Atenolol would experience some form of fatigue at some point in time. Now, for the most part, most of these side effects are generally mild, and your body kind of handles it as it gets used to the medication. So most of the time, it is not reason to discontinue the medication. But however, if it persists, then it's definitely a good idea to have a discussion with a doctor to make sure that you are a good candidate to be taking Atenolol. Now, some precautions and some best practices. The first one is people with a history of breathing problems. Like I mentioned in the side effects, Atenolol has the ability to affect your breathing. So if you're somebody who already has a history of breathing issues like COPD, just be wary, have that at the back of your mind when you and your doctor discuss Atenolol as an option. I mean, there are a lot of people that have such problems and still take Atenolol without any issues, but it is worth noting. If you are diabetic also, note that Atenolol may mask some of the manifestations of hypoglycemia. Typically, tachycardia or an increased heart rate is a good sign to know that your blood sugar levels have dipped too low or you are hypoglycemic, and Atenolol may mask this. So this is something worth noting if you are diabetic and take Atenolol or any beta blocker for that matter. Staying on the topic of diabetes, Atenolol is known sometimes, though rare, to increase blood sugar levels. Therefore, be a good idea to discuss with your provider if any changes in diet or your medications is warranted as you take Atenolol. Like any other blood pressure medication, especially beta blockers like Atenolol, it is not a good idea to discontinue abruptly, more so for people who have thyroid disease. This is because the effects of hyperthyroidism, which include tachycardia or increased heart rate, is masked by a beta blocker like Atenolol, and therefore abrupt discontinuation of that Atenolol may lead to what we call a reflex tachycardia, and it may lead to something called a thyroid storm. Now, a thyroid storm may be characterized in some instances by potentially life-threatening elevations or increases in blood pressure. So definitely not a good idea to discontinue your atenolol abruptly. Even if you don't have thyroid disease, discontinuing atenolol abruptly can still lead to some dangerous elevations in blood pressure. So irrespective of whether you have thyroid disease, it is still not a good idea to discontinue atenolol abruptly. Best case scenario is to work with your provider to taper it off gradually. With all that said, atenolol is still considered generally safe. It's very widely prescribed. It's a very common medication. So if you're taking it and you are not having any issues, that is perfectly fine. Obviously, discuss any unusual feelings you're having with your doctor to see if a substitute may be found for you. Thank you so much for staying through this video. I hope you enjoyed it and found some value in it. If you did, consider subscribing to the channel and give it a thumbs up. I'll catch you on the next video. Thank you.